I did a revision breast implant surgery on a patient yesterday who had breast cancer and had some untoward results that they wanted improved. And when I went to go do her surgery, we opened up her breast and I found an implant that looked like this. So just for comparison, this is a silicone implant, and you can see that this one, which is a sample, is clear. And when I opened this pocket, I noticed immediately that it was opaque. And just based on my experience, I knew that the implant was ruptured. Well, it was interesting because I didn't really see a hole at first. I didn't spend a lot of time looking for a hole because it wasn't going to change anything. But we temporarily put this in some solution that had betadine. And if you look closely here, we saw that there was a little opening there. So when I then went to go squeeze, I don't know if you can see that, right? There are two little holes in there where the rupture was. And the reason I'm showing you this is really for two reasons. Number one, the prior surgeon probably caught it with a stitch because those are two needle holes when they were closing the breast. Number two is that even though there's a rupture that was present for a while to turn this opaque, there was no silicone outside of the implant at all. So you can feel it's very smooth, there's no silicone staining, and you can see how I can't even get the silicone to come out of the implant when I do that. So, you know, these implants are so thick and cohesive that they really not only retain their shape, but also there's no significant silicone spillage like the older models, which would spill a lot. So patients who are concerned about silicone spillage just have to realize that it's mostly self-contained within the implant. If not, it's within the implant capsule.